The nurse is logged into Enterprise Health and clicks on the scheduler to view available walk-in appointments. She chooses an available time slot for the employee, Eleanor, and types in her last name and first name to locate the record. She can also search by the employee ID number. She types in the chief complaint of sore throat and indicates that she would like to send an appointment confirmation email to Eleanor to block that time as a private appointment on her calendar. The nurse sends that email as an iCalendar invite, which is an ICS file that will be accepted by Outlook, Lotus Notes, or any email application. The nurse Nicole is scheduling Eleanor with the nurse resource, and she chooses an appointment type of non-occupational health initial visit. The resource location, date, and time are preloaded. The duration of the appointment also automatically populates based on the appointment type that was selected. The nurse then clicks to save the appointment, trigger a confirmation email to be sent to Eleanor, and display the appointment on the schedule. When Eleanor arrives at the clinic, the receptionist goes to the scheduler and clicks to check her in. The system will start tracking how long Eleanor has been waiting in the waiting room. The nurse clicks on the scheduler and sees that Eleanor has checked in for her appointment as well as how long she has been waiting. When she's ready to take Eleanor to an exam room, she clicks on the waiting room and changes Eleanor's status to exam room 1. This starts the time clock over to track how long Eleanor has been waiting in the exam room. Next, she clicks on Eleanor's name to go to her medical chart, which shows a summary of any allergies, medications, past medical history, and prior documentation. The encounter visit also automatically opens based on the appointment type and the reason for visit. The nurse clicks on the visit link to go to the encounter. At the top of the encounter, basic information populates automatically. The chief complaint pulls from the appointment. The nurse clicks on the chief complaint section to add how many days Eleanor has had these symptoms. Next, she clicks on the history of present illness section. In the HPI narrative, she documents that the patient's daughter was recently diagnosed with strep. The patient's throat has been itchy and sore for 3 days. Next, she reviews the past medical history with the patient. The autocomplete field will bring up a list of both brand name and generic medications, as well as over-the-counter. Once she chooses the medication name, the system will bring up different strengths that are available. This information automatically updates once a week from the first databank database. She documents that the patient is taking ibuprofen 200 mg, tab for package instructions as needed, and orthotricycline daily. Next, the nurse indicates that Eleanor has no known drug allergies. She did have a flu shot in October of 2015, so the nurse documents that in the injection section. The nurse reviews the social history and updates the smoking status. In the review of systems, the nurse will indicate that everything is normal for general. In ear, nose, and throat, she types to see the history of present illness. The macros off to the right allow the nurse to quickly enter information and use shortcut keys. She also has the ability to edit that content or free text any additional information. All of the free text fields within the system support voice recognition, so she could use voice recognition on an iPad device or using Dragon Medical. Next, Nicole will take in Eleanor's vitals. This will default to today's date and time, and vitals may be uploaded from the device or entered manually. When she takes in the height, it will automatically translate into inches and the system automatically calculates the BMI. There are target ranges for each vital. If the value of a vital is outside the target range, the system will automatically alert the nurse to double-check the value. If the BMI is out of range, the system will recommend a dietary consult and automatically add that order to the visit. Once the nurse has finished entering all of Eleanor's information, she will click on the provider button to move this to the provider work list. This will notify the provider that the patient is ready to be seen. When Dr. Patel is logged into the system, he can view the clinic work list by stage on his Quick View dashboard. This shows him that there is a patient that is ready to be seen. He can see that Eleanor Washburn is in a provider stage and that she's been in exam room 1 for 11 minutes. Dr. Patel clicks here to start his visit. This brings up Eleanor's visit encounter, showing all of the information previously entered by the nurse. Dr. Patel reviews that information and conducts his physical exam. As he opens this section, he can document different areas that are normal and any additional documentation. Dr. Patel decides to order the strep test. He clicks Tests and Procedures to order the test. He then clicks the nurse button to send this back to the nurse work list for her to conduct the strep test. The nurse can view her clinic work list from the Quick View dashboard. Here, she can click to go back into Eleanor's visit, which takes her to the visit encounter. From the objective drop-down, she can go directly to the tests and procedures section and also see that Dr. Patel ordered a strep test. To document the results of the strep test, she clicks on that section. The results of the strep test were positive, and she can mark that the test has been completed. There is also a free text comment field to add additional notes. After the nurse completes the test, she clicks the provider button to send this back to the provider work list. Dr. Patel can see that Eleanor is back in the provider stage from his quick view dashboard. He clicks here to go back to the encounter. From the encounter, Dr. Patel can quickly view the strep test results to see that the test was positive. He clicks here to add a diagnosis for the visit. He can search by code or description. The system supports both ICD-9 and ICD-10 codes. Next, Dr. Patel adds an assessment narrative. He will electronically prescribe an antibiotic for Eleanor, which the clinic can dispense so that she can leave the clinic with her medication. As he orders oxacillin, the quantity available will show up next to the medication name. Any alerts will show up at the time of prescribing as well. In this case, it shows a drug interaction with the orthotricycline. When prescribing a medication, the system also shows different strengths the medication is available in. And when using the inventory module to dispense medications in-house, it shows the quantity available for each strength. The doctor can click on the eye icon for drug guide information. This shows additional information about drug interactions and dosing guidelines. There is also a dose button, where Dr. Patel can view the dosage calculator. The system will automatically calculate the quantity based on the SIG that's entered. The doctor can indicate if there are any refills allowed and whether or not they can substitute for generic. The system will bring up the most common reasons someone might take that medication, and Dr. Patel can choose from a list or free text additional information. He then clicks Add to add the prescription. In the Visit Orders section, Dr. Patel also wants to do a referral to an outside provider, an EMT specialist. He clicks Make a Referral Order and can indicate how soon Eleanor should be seen, or if the appointment has already been scheduled, he can indicate the date and time of the appointment. Dr. Patel also wants to order a throat culture. He can simply start typing throat culture and it will come up in the drop-down. He can also use an order pick list above. Dr. Patel would like Eleanor off work for 3 days, so he adds a restriction to her chart. The restriction links out to the active problem list, so we can choose strep throat as the problem associated with this restriction. Down at the bottom, he can indicate the start and end date for the restriction or if it's a permanent restriction. The system automatically fills in his name as the provider issuing the restriction. Dr. Patel is finished with all of his documentation, so he clicks the nurse button to send this back to the nurse to finalize paperwork and release the patient. As Nicole logs back in, she can view the clinic work list from her quick view dashboard. From here, she can click to go back into Eleanor's chart where she can go to the charges section and document any charges for the visit. She can type in the CPT code or a description for the charge. There is a fee schedule loaded in the background which will automatically calculate the cost. She can also add modifiers if needed. In the patient education section, she can mark that patient education material was given and print patient education materials from HealthWise. Enterprise Health has an optional interface with HealthWise that will pull up recommended patient education based on the diagnosis and medical condition in their record. In the depart instructions, the nurse can add additional information for the employee. Nicole advises Eleanor to follow up with a nurse in 3 days. She can also schedule a follow-up appointment. Once she finishes entering information for the follow-up appointment and clicks Save, an appointment confirmation email is automatically sent to Eleanor, blocking that time on her calendar. Next, the nurse will archive and close the encounter. This will close out of the visit encounter and create documentation in her chart. The final documentation only shows the sections that were completed throughout the exam. The system also creates a clinical summary that is given to Eleanor. This shows a high-level summary of the reason for her visit, her vital signs, and the results for today's encounter. It also includes the depart summary information. At the bottom, any prescriptions that need to be filled in-house or printed or faxed to the pharmacy are listed. The Enterprise Health system also has the ability to send prescriptions electronically directly to the pharmacy. Nicole can also see the referral that was ordered, which can also be printed or faxed. All of the documentation for today's visit shows up in the Document Summary Chart tab. This shows a listing by date of service and by the type of document that was created. To review the referral to the ENT, Nicole can click on that document. She can then click in the header to fax this information to the ENT provider. This will default to her location's fax cover sheet, and she can choose the ENT provider's fax number from the system. She also has the ability to click Manual and manually type in the name of the person and the fax number that she is sending to. There is a comment field where she can add comments that will show up on the fax cover sheet. She then clicks Fax to send the fax. Nicole can now check out Eleanor by changing her station to checkout. This will stop the time tracking. Time tracking information for all visits is used to calculate average wait times and the clinic's average time from check-in to check-out. Nurses can run a report at the end of the day, or there is also a Check Inside menu tab that keeps real-time statistics of that information throughout the day. This concludes our demo of clinical care. If you would like additional information on functionality, please visit our website at enterprisehealth.com.